Doula Date Live. This is Monica. She's here with me today. I'm Jen. I'm a nurse. I'm a doula. I've been a lactation consultant now for about a year. But Monica has been a doula for how many years?
3 years now.
3 years. And she is really well versed in tongue and lip ties. So that's what we're going to be talking about today. She's had her own experience with herself, her children, several clients, and I would just love for us to hear her stories. We think tongue and lip ties are super important. A lot of breastfeeding moms or bottle feeding moms notice that their baby may not be feeding how they think he or she should, and they get sometimes dismissed, would you say, by a practitioner?
Yeah.
That, oh, they'll grow out of it, or
Yes.
it's just a positioning thing, but mom is either having...
Or maybe you have supply issues.
Yes, mom is having a lot of times nipple pain, or baby is having trouble, and we just want to give a voice and shed light to this issue, that it does exist, and it's important for mom's health and well-being, her breastfeeding experience, and baby's health, well-being, and baby's future. So I'll let Monica tell us a little bit more about her story and how you became so well-versed in this and introduced to this topic.
Yeah, so I don't have professional background with tongue ties. That's not my background. Mine is very much from a personal experience and from, again, what my clients have experienced. With my oldest, we initially needed a nipple shield. He would not latch on at the hospital, and I was a very young mom with very little, I didn't take a breastfeeding class ahead of time. I didn't, none of it. So I was very much relying on those around me to give me the information. I was not doing my own research, which I think was probably the first problem.
You trusted those that you
I did. I very much trusted those.
Yeah.
And so we started using a nipple shield with him, and used that for about the first 3 weeks. And then my aunt was a NICU nurse at the time, so she came over and helped us with latching and positioning, and we went on to have a fantastic breastfeeding relationship. He self-weaned at 14 months.
That's awesome.
It was great. I didn't have to worry about weaning. That was fantastic. That's a whole
and
other.
You went 14 months.
Oh yeah. He
That's
was
awesome.
He was a great nurser. But I did, after I stopped using the nipple shield, I did have my nipples would always look kind of like lipstick tube shaped. They weren't like this nice big round, like kind of like cherry shape, or like.
And that's something to look for, moms, when you're breastfeeding. As if you're like, I really think something might be constricted or tied here. Look at the shape of your nipple and the condition of your nipple when baby's done breastfeeding.
Absolutely.
Yeah.
I think because his was just a little bit of the shape, I didn't take it into too much consideration.
Sure.
I wasn't having a ton of pain, like nothing like that was sending up major red flags.
Yeah.
My middle daughter, or my middle kiddo, she had all sorts of issues, but tongue ties were not one of them. Dairy allergies, however, were. But it was my youngest that, third breastfed baby. My middle child breastfed till she was 2.5. She did not want to give it up, and very struggle child. And mommy didn't have the heart to fight it. So with my third though, I was having, again, the misshapen nipples, but with him, I did end up with cracked and bleeding nipples.
Wow. And how soon?
Oh gosh. I remember them being pretty sore for like the first couple days, thinking like, okay, this is just the initial, we're kind of getting used to this again. Because I had a little bit of that with my daughter, just as things get, kind of used to being industrial again. And so I finally was like, how do I put this really nicely for people? Industrial.
Putting them to use.
Yes. So yeah, they become, So with him though, it was probably about the week mark that I realized, like, I'm bleeding. Like, what is going on here? And I was using tons of nipple butters and airing things out. And I'm like, why is this continuing?
Yeah.
So I asked my doula about it. And, man, I had been at, like, our postpartum appointment. I think it might have been at our postpartum appointment that I initially mentioned it. Like, something's going on that's very different than my older two.
Sure.
Which I think is the first clue when you're like, wait a minute, this is that different, what's happening.
If it's your first baby, what would you tell moms to look for to start to have those warning signs?
Definitely the misshapen nipples, cracked and bleeding nipples. If your baby is spitting up and you're noticing blood in their spit up, like there's something going on there.
Would that blood be from you?
Yes.
Okay.
Yeah.
So
from nipple trauma. It can happen. We call it strawberry milk. Not going to hurt your baby, but like, hey, there's something to look at here because, well, breastfeeding, you have sore nipples initially, like while they get used to being used industrially, they should not be cracked and bleeding, and you're like toe curling pain the entire breastfeeding session. And I do remember that. I remember sitting in our bed feeding the baby and thinking like, okay, if I just like curl my toes and grit my teeth for like 10 seconds, it'll be over. And that does happen for a lot of new moms. Like that is pretty typical. That initial latch, right? But this was lasting like the entire breastfeeding session. I remember, look, I'm having a little bit of flashbacks right now. I remember like toe curling, and I remember crying, and I was like, this never happened with the other ones. And that should not be how a breastfeeding relationship is going. So, God bless my doula. She had me come in. She worked at a chiropractic office. She had me come in and see their pediatric chiropractor, who immediately diagnosed tongue and lip ties.
So your doula was kind of the
she was our middle person. Yeah, absolutely, absolutely.
Doulas are wonderful.
Yes, for many, many reasons. And I think people don't understand enough about postpartum doula work and
how educated doulas
are.
Oh,
absolutely. Yeah, we're kind of jack of all trades. Really, that's. We bring in personal experience, we bring in professional experience, and it's just this wonderful marriage of everything that we can bring to the table. So, so she diagnosed tongue and lip ties with him. He was 2 weeks old at that time, and immediately. And
it was a provider, correct?
Yes, this was a pediatric chiropractor.
Your nurse, your doula, your lactation consultant, they can all refer and suppose a tongue or lip tie, but they can't diagnose. Correct. Or necessarily do the revision.
Correct. So now a chiropractor can diagnose it.
Okay.
As a body worker, they can diagnose it. There are different assessment systems that they use.
Practitioner.
Yes.
Okay.
So a lot of people will, like I see it on the moms groups all the time. They'll send a picture of baby crying, or they're trying to look at the frenulum underneath here, or they'll show like the upper lip, and and they say, "Does my baby have a tongue tie?" And we might be like, yeah, that looks like a really thick frenulum or frenum, or they're not lifting their tongue very high. I remember my youngest, when he would cry, his tongue would barely come off the bottom of his mouth.
That's something to look for, because when you have a tongue tie, or when baby does, your tongue is restricted in elevation.
Yes. Yeah. So, and the tongue is supposed to do this wave move across the top of the, I mean, you know this, but right, exactly, across the top of the roof of the mouth in order to transfer the milk through the mouth and down through the throat. But these tongue-tied babies can't do that. So what they're doing is, instead of creating a nice suction with their tongue and the top of their mouth and with lips, they're like hoovered on with all their with all just their tight muscles around here, and that's what causes all that nipple damage, because it's not that proper tongue wave motion. And
even if they're not breastfeeding, if they are kind of spitty with a pacifier or a bottle, they're just like kind of spit in and out. They can't hold
it in.
That's something to look at too.
Yeah.
Especially moms who are pumping and bottle feeding.
Absolutely. Or even formula fed babies. Like if they're having a bottle and they're not able to hold on to that bottle, or they're right at the end of it and they're just like, their little lips look all blanched. Another one is little blistered lips right here, because they're so tight holding on there. So yeah, it can cause a lot of issues. Yeah, a lot of babies can't hold on to that bottle, or they're not gaining very much weight because they're working so hard trying to keep that in their mouth that then they can't use those calories to do whatever.
Their calories are like, or their feedings are like a workout while they're getting their calories. They're burning what they're taking in. So. Which
would be great as an adult. It would be awesome. I could eat and burn all my calories, but that's not what we want the babies doing. So, after the diagnosis, I went into like, okay, I need to know what we're gonna do. And you initially think, okay, well, we gotta get this revised. We need to surgically revise this right away. The crazy thing is that's not the first thing you want to do. The first thing you want to do is body work. Because
where's the first thing you guys did?
Body work.
Okay. And what kind?
So we did chiropractic care. Other forms of body work would be cranial sacral therapy, which we, luckily our chiropractor, sorry, I get talking very fast. I get very passionate about this.
This is good. A ton of information.
It is a lot of information. Feel free to message me if you have questions. So with body work, there is also, so it's chiropractic. There's one called cranial cranial sacral therapy, where they're
Okay.
actually working on the muscles of the face and the neck and the upper back and shoulders.
And is this like adjusting or more like PT?
It's,
or
oh
what can
gosh,
the moms expect?
it's almost, my baby fell asleep through all of his. Like, his chiropractic care and his myofascial release or cranial sacral therapy, literally he would go to sleep during it because it's so
it's not
gentle.
painful.
No, there's no popping going on, no cracking, like not what you think of as far as like adult chiropractic goes, where you hear, the release of all of that. With this, I mean, baby's flipped over and the chiropractor is like gently like
Moving.
almost, it looks like massage, but they're just kind of seeing if things are in. And he was always out on one side because the tie was tighter on that side. But yeah, she'd be working on him. He was so relaxed.
And as a mom, that probably felt really good.
It did. Like, okay, like this is good for him. Because he's a pretty chill baby in comparison to my older two. I can just imagine if we'd had my middle one in any sort of body work, that probably would have been really helpful because she was high needs. But yeah, he loved the body work, and I as a mom appreciated that body work because I could see him relaxing, and he was turning his head in different ways. That's another really common thing as babies get older. If a tie is not diagnosed, they can end up like only wanting to keep their head one way or the other, or they're cockeyed a little bit. Their head becomes asymptomatic.
See that, and when they're feeding, they might just want to feed on one side or in one position. They're not.
Or if you had a baby that during birth was asymptomatic the whole time, if they're like, your baby's not coming down the right direction, like their head is, it goes back to in utero. Like some of those little baby heads are cocked like that because they're tied. And so if you go back to your birth and you kind of think through like, what were some of the reasons, A, B, or C might have happened in birth? It might have, crazy enough, been from a tongue tie.
Just putting all the pieces together.
It
to
is.
see where you're at now.
Yeah,
Okay,
seeing all those layers.
So you did the body work.
Yeah.
Did you see immediate changes in breastfeeding?
Not a ton in breastfeeding yet.
Okay.
But I hadn't expected that because I knew I needed the revision. So tongue ties, you need multiple facets going on. You need your body worker, you need your provider who's going to do the release. That is typically pediatric dentist can do it, oral surgeons can do it. There are some ENTs that can do it. Not everybody that does it in a way that maybe you might want them to. There's
some midwives have done. I've seen done it as well.
There are, yes. Basically, you want somebody that you can get lots of recommendations about, that you can talk to their patients, ask what that experience was like, ask what the aftercare was like. Really important. So you've got your body work, you've got your whomever provider is doing the release, and then if you're breastfeeding, you want your IBCLC, somebody that is knowledgeable about ties, because it's not everybody is. Your hospital-based lactation consultant will not give you a tongue-tie diagnosis. I don't know why, but they are not able to. And
could you touch on that some more?
yeah.
So if you're in the hospital and you're right before you go home, you've stayed your 2 midnights, and you're like, something's not right here, and I want to see an IBCLC, what would they say and why?
They'll probably tell you that there's some sort of latch issue that's going on that needs to be corrected, and they'll give you some different suggestions, because there are different breastfeeding positions that can work really well for breastfed babies. Leaning back, coming at it more like a football hold and coming over the breast can be really helpful, because what you're doing is you're not overloading their mouth with lots of breast tissue. You're kind of helping them to create that. How would I say that?
Vacuum.
Yeah, that vacuum and that ability to control a little bit more versus gravity having so much to do with it. So there are positions that you can use, and your lactation consultant might suggest those different positions. And there are a couple really cool lactation consultants that will say, I think this, it's kind of on the down low. I do not know the official reason why, but they might say, yeah, you might want to go get baby checked for a tie, but they will not diagnose it.
What do you think the hesitation or stigma around ties in the hospital world exists?
I don't know. There are pediatricians that do not believe in tongue ties. They're like, these do not exist. This is not an issue, and it is.
I worked in the NICU at a children's hospital, and you did have to advocate, or even we saw patients in the next to, and it was an advocation.
Oh,
But I
gosh.
think the providers were really good about, if mom is having pain, they see or can assess the tie. They were really good about knowing how to feel for it, look for it. But it wasn't something that your IBCLC could write up on a slip. I recommend that I see. It was a thorough assessment and evaluation process.
Yeah, it's not just a physical assessment. Like they're in there and they're seeing like, how is the baby sucking? What is this oral function like? It's not just looking at a picture of what is physically going on. They need to see the whole
They want
picture
to see
of how
a
this is
feeding
happening.
and the transfer. And
Yes, wave
even
feedings.
some moms, even if your baby does have a tie and they're transferring, that's a hard. You're up against a tough battle. You know, especially if you breastfed before and you know this isn't right and all the signs are there, but your baby is still strong enough, or maybe getting older. But advocate for yourself and for your baby, because what are the lifelong repercussions?
Yeah,
of ties?
so my oldest, the one that we use the nipple shield with, and I didn't realize he had a tie, he is in fact tongue tied. He has a tie, he has an upper lip tie and a posterior tongue
So
tie.
you, yourself, and your three children.
2 of my 3.
2 of your 3, all tied.
Yep, we're all tied. My husband is not, my daughter, my middle one is not, but the boys and I all are. So I had mine revised 2 years ago when I was 31, and my oldest is 9, and he's in speech therapy. He's got this sweet little gap in between his teeth that I do not mind one bit. However, we were at his most recent dentist appointment, and our dentist said, if you're planning on doing any orthodontic work with him, he's going to have to be revised because that tissue is so tight that any orthodontic work is going to slip right back out. Because those oral that oral tissue is also tense all the time. And actually, we did have to take him to the chiropractor a few times because his upper neck and shoulders would get kind of stuck like just like I had, and we would go in and get him worked on. And
Monica was saying after her revision, you just felt this release.
Oh, complete. It was like literally when she did the revision, all of a sudden I felt like this physical release through my neck and shoulders. It was very strange.
You were posturing yourself.
I was, my posture was always a little bit shoulders up, which as a dancer, I heard a lot, like drop their shoulders, and I'm like, I'm trying to drop my shoulders. Like I couldn't physically drop my shoulders. And I kind of always had, my chin was a little bit forward because again, everything was so tight back through here.
That makes so much sense.
And I would have headaches. I had TMJ that at one point in time they were saying, oh, you need to do cortisone shots and all these things, and it all went back to the tongue tie. Headaches, mini migraines in the afternoons, and once I did the tie and all the therapy and body work that went along with it, because when you have a body that's that tense for 31 years, all your connective tissue, your fascia, just winds up like a really tight slinky.
So you did those 3 things for yourself and your babies.
Yes. And so it's not a cheap thing. It can, and that's a really hard thing. A lot of my clients, I had 5 clients this summer that babies had tongue ties, and the hard thing is that it is a process that can be covered under insurance with your dentist. Most places, if you're just doing like an upper lip and a tongue, it's about $600. That's just the revision. However, like my insurance at the time did cover it. Like we paid up front and then we did get reimbursed by our insurance.
And what about the exercises? If you've had a revision, you'll be familiar with this or your baby, but mom's thinking about it, wanting to get assessment. This is really important about the revisions or about the exercises after a revision for home.
Yes, there is one dentist here in our area that does a lot of revisions.
And we're in Kansas City.
Yeah, we're in Kansas City. We have a couple of great providers in Kansas City. There's one in Wichita that's very, very popular, very well respected. There's a lot of people in Kansas City that travel to Wichita for this particular provider because he has body work and an IBCLC on staff. Like that's how you know someone's serious. Like when they've got all of that stuff already ready to go. It's pretty cool. So we're getting there in Kansas City, and there are amazing body workers here. I'd be happy to share information on those folks that are just very, very passionate about this issue, because it's not just babies. It carries through to your kids, to your teens, to your adults, and it's something
adult
you don't.
Posture, speech, just the shape, like orthodontist or dentist. It affects a lot.
Yeah, I've
snoring, sleep apnea.
Yep. I've seen pictures. We have a really great Facebook group for Kansas lip and tongue tie education, and on there are images.
And you can just search it and join it.
Yep.
And they'll ask you a couple questions.
Yep. There are images of some of the families with adults that have done the revision, and you see their recessed jaw come forward because of that release.
Wow.
Mine wasn't quite that tight, but my jaw would swing to the left. And so that was a lot of my therapy, was keeping my jaw in line, because then of course everything would get really, really tight.
Sure.
Because of that, I had to learn how to re-swallow properly.
Yeah.
I couldn't do anything fizzy, any drinks, because it would hit all along my cheeks, and it freaked me out. And now that I'm revised, if I'm swallowing properly, I'm like, oh, this is why people can drink carbonated stuff. It doesn't hurt going down.
So as an adult, that could be a sign.
Weird things.
And they don't, as far as causes of tongue ties, there's a lot of theory.
There is.
And genetics is probably the
Big
one
one.
you hear the most. I'm really passionate about chronic illness and autoimmune disease. They talk about environmental factors, nutrient deficiencies in mom, folic acid, folate acid. They talk about some herpes viruses, and MTHFR mutation gene.
That's a big one, I heard too.
So, if you, and that's not to be afraid, if you have some of these predisposition conditions, just knowing if you're going to have a baby, you have a baby, or you're worried, you have any of these and you're worried about, or any really chronic condition and you're worried about your baby with a tongue tie, that's something to think about, to just advocate your case.
Absolutely.
Because when you have that mom instinct, it's always right. Something is up. Always trust your mom gut.
Absolutely.
Or just your womanly intuition if you don't have kids yet.
Yep, absolutely. Yeah,
So,
that can't be spoken for.
was there
That can
anything
be
I
lots of
didn't
things.
touch on causes that you've heard or come across?
No, genetic is the biggest one that I hear.
Yeah, because obviously she had it, 2 of her 3 kiddos.
Yep.
So, but we're really lucky that we're in a day and age where we can do something about it.
Yes, because these babies for a long time, they think that colic, a lot of these babies were just diagnosed with colic, or they, I hear it so many times with like women my mom's age, like my supply was just terrible, my breast milk wasn't good. I hear that, oh, that kills me when they say my breast milk just wasn't good.
Yeah.
Okay. There's a lot though, you can go back and you look and you see these issues that, whether it's food allergies or it's tongue ties or, there's just so much more than just my breast milk supply was low, or.
So don't accept that for yourself.
No.
Your body is amazing, and giving the right support, information, and tools, your body can do what it is designed to do for yourself and your baby.
Well, and I have a very sweet client of mine who was a good friend before she was a client, and they went through the process, and baby still does not want a nurse, but baby's able to take a bottle fine.
Yeah.
And I could sense that, like, man, we went through this and we did all the things and still not nursing. But what I want her to keep in mind is that she has now prevented her child from going through their entire life having all of these symptoms that come back to something that could have been taken care of when they were itty bitty. So now, unfortunately, my 9-year-old has seen the baby go through a revision and myself go through a revision, and I won't lie, it's not the most pleasant thing in the universe. You're disconnecting tissue, and you can be pretty sore and bruised for a couple of days.
And for moms having a revision done on your baby, they do numb, and they do allow you to.
Not all dentists numb.
Okay. I'll have you touch on that, and they will allow you to breastfeed right after, and that's actually a comfort care.
Yes.
So so tell me about not all dentists numbing.
No, there's a couple of dentists that don't.
Okay.
And some that do.
Yeah.
I did, and that as a mom, when I was deciding, like, do we do this revision? Because there was that moment of, am I making the right choice? Because there is a lot that goes into it. I went down like the research rabbit hole and really freaked myself out, and ended up messaging with some moms that had already gone through it, and they were reminding me, like, they were doulaying me, like, you're making the right decision, you have the information, your gut is telling you to do this, but it's a hard thing to make that decision to do. So our particular dentist did not numb.
Okay.
Did
not numb you?
Oh no, they numbed me. So we used 2 different dentists. We used a pediatric dentist for my then 3-week-old. He's 3 years old now.
Okay.
And then I used a family dentist for myself that did a lot of revisions. But the pediatric dentist still does not. And it's was not fun as a parent to see. My husband stayed in the room and I stayed crying in the other room. But as soon as it was done, they brought him to me and he nursed, and I immediately felt a difference.
Yeah,
It was
that quick.
It was that quick. All of a sudden, his tongue could move up and down, and I could feel it. And I was like, "That's the feeling I've been missing.
Yes.
That's what it was." Because his little tongue just couldn't lift up enough, and then it's squishing everything and just creating this suction of all the everything else that's not supposed to be happening. So yeah, it was kind of crazy. But I will tell you, the infants recover a lot faster than the adults. So it's and again, now my 9-year-old has seen that, so he's like, oh shoot, I'm gonna go through all this that mom went through. And but it's I don't want him to get older and continue having all these issues that could have been taken care of when he was 9.
Do you think he'll want to get a revision?
He is not on board right now, which is why we haven't done it yet.
Sure.
I wanna respect that.
Yeah.
But at the same time, I think as he gets older and he's
Sure.
able to think through, like, this is why mom wants to do it, instead of mom's just really horrible and making me do this, that he'll understand why it's a benefit to his body.
And that's nice that you've been through it, so you can tell him. So if some moms are on the fence or maybe just anticipating, that their baby might have this, what resources can we give them? So Facebook groups, websites.
Yeah.
If you are going to get a revision, what was the Facebook page? So do your research on the exercises to be done after. Some providers are really aggressive with what needs to be done, and that's the way I was trained as an IBCLC. But you gave a lot of good information to me about breastfed babies really not needing the aggressive.
Yeah, they do not need the aggressive stretches and rubs.
That is how I was always taught.
Yeah, and it can actually create more scar tissue. Actually another
and where can they grab that research or that information?
So that would be particularly if you're able to get onto the Kansas Lip and Tongue Tie Facebook page. The admins there are phenomenal. I mean, shout out to the admins. They have really great files and videos on there that show very, very gentle exercises to do versus these rubs and stretches. Because when you even just say like rubs and stretches, it's like, oh gosh,
that tissue is real sore.
Oh, it's so sore. But instead, it's these just exercises and activities that you can be doing with your baby that help them to move their tongue in a way that they are part of that process versus mom doing it to the baby, because that is really, really tough as a mom when you're doing these rubs and these stretches that you were told to do by people that that are in a
oral aversions can be a real thing.
Absolutely.
Especially trauma to the mouth.
Yep. So this is a much gentler way to do it. Dr. Gahary is really, really popular.
His Facebook page.
Yes, his Facebook page is awesome. He also has a lot of videos about these stretches and about identifying tongue ties and what that looks like. And so yeah, he's a great resource. So those are my 2 big resources.
Any books or articles, podcasts?
There is yes. Oh, so I am a huge fan of the Birth Queens with a Q. And they have a really great podcast about lip and tongue ties that's got a lot of really great information. It's a dentist that's on, and she's talking about pretty much any of like the basic info that you would need. They're great. I send that one to all. If I have a client that we're thinking there might be a lip or a tongue tie here, I send them that podcast immediately.
And then how can people reach out to you and find you on Facebook?
Yeah, so my Facebook page is just Monica Drake Birth Doula. I'm very not creative. I don't have a cool business name. So just Monica Drake Birth Doula on Facebook. I'm also on Instagram, and then my website's just www.monicadrakebirthdoula.com.
And you serve the greater Kansas City area?
I do. Mostly down south, mostly south of the river. But yeah, kind of all over the place. And if you're somebody that just has more questions about this, feel free to message me. It's a big deal, and I want you to feel supported.
She's passionate, she's knowledgeable, and she would love to help steer moms in the right direction.
Absolutely.
So, well, thank you.
Of course.
Yeah, I hope you guys got some information out of this and enjoyed this. And if you have a topic that you want discussed for the next Doula Date Live, go ahead and send one of us a message, and we'll